All right. I don't know if we are live. I think we are. Let's see. End broadcast, banner. All right. If you can hear me and see me, let me know, please. So let's see. Okay, good. All right. Let me know if you can hear me and see me for the Facebook Live. All right. If you can hear me and see me, just say hello in that chat area. I want to make sure this chat is working. Some of you know that I'm using a new broadcast. So let's see if it is working good. All right, good. All right, I got thumbs up. Okay, good. All right, it's coming in. Wow, this actually worked. All right, good. Oh my, what technical difficulties the last two Zooms. All right, let's see who's on. All right, Sue, welcome. Ed, I see you. Clarence, let's see who else do I see here. All right, we have Facebook coming in. Hi, Stephanie. All right, we have Facebook, we have YouTube, we have another Facebook channel. We have quite a few places coming in. All right, how is everybody doing tonight? All right, good. Hello, hi, Carolyn. All right, welcome. Wait, let's see this. All right, so this shows. Hi, good, Clarence. All right, so all right, good. Hi, Valerie, welcome. Hi, Russell, welcome. All right, this is great. Okay, so this is working a lot better than that other the other one I was using. All right, I'm gonna hide the banner. All right, there we go. And I'm still trying to figure out how this works. Hi, Carla. Welcome to the webinar. Or webinar, geez. Facebook Live shows you how many webinars I've done. All right, good. Excellent. And can you guys see each other in the chat? I want to just make sure we work out all the kinks here. Can you see each other? Hi, Thomas. Let me know if you guys can see each other because it says something on mine where I could actually show everybody's. Or maybe I could show, let's see if that's working. And I also think there's a little bit of a delay. So I know I ask a question and it takes a few seconds. Hello, hi, Bernetta. Okay, so you can't see other people in the chat. All right. And you don't see me. Does everybody see me? If you could see me and hear me, give me a thumbs up. I can see their comments. Okay, good. Thank you, Russell. All right, good. Usually I don't have to work out all the kinks, but this is a new software. Last time we did one last week, the thing crashed. My video was bad. So this won't be good. This will be much better. All right, good. Excellent. All right, more and more people are joining us. So let's hop right in. This is exciting. So these Facebook Lives, for those of you who've never met me or have been to a Facebook Live, this is going to be a question and answer period that I get questions throughout our Facebook group, which has grown exponentially over the last few months. But these are questions people want to know, not about managing diabetes, but about reversing diabetes. Since I've been doing it for so long, we actually had 5 cases today who are no longer diabetic. And one of the actual patients may be joining us. I'm not going to mention their name, but they're in my office for less than a week. And they're already off of insulin. He's a great guy. And I said to him, I was like, no one's going to believe you that you've been on insulin and after a week in my care, you're off of insulin. And he's like the coolest guy ever. He's like, I don't care. Give him my phone number. I'm like, I'm not going to have like 20,000 people call you. I was like, that's not reasonable. But I was like, I don't know. Just do like a testimonial if you want or something. He's like, I can't believe it. I'm already off of insulin. So I'm going to be talking about how this happens, right? So even though you may not be a patient in my office or you can't be a patient because you don't live in Florida or maybe I don't have a spot available for you, but this is where I show you and teach you the approach I use that has worked thousands and thousands of times. So anyway, there's going to be a Q&A section. So while I'm over here kind of giving the intro in that chat area, if you would like to put your questions in there, please put them in there and then I'll make sure I get through that chat. This way I could see the questions if there's anything specific. And then we end off, you'll have your questions answered to the best of my ability. All right. Couple quick updates. For those of you that are new, we got to over 1,300 members on our Facebook group, fastly going up to 1,400, which is just incredible. And just so you know, there's times where we just stop inviting people in just so we could kind of like make sure everybody's a good fit for that group. So we're going to be opening that up again. So if you have anybody that you sent over, just realize it does comes in ebbs and flows. Sometimes 50 to 100 people come in a week, and then other times there's just a few, and that is because we turn on and off that faucet just so we could make sure that we review everybody. The next thing is we have over 2 million views on YouTube. Many of you have followed my YouTube channel. I'll be adding a lot more videos on there. So I've been working on a few different videos that I've been pretty busy with that have not been able to get to. So you'll be seeing those also. And then I think people have been asking about the sale that's going on the website. So there is a sale going on the website. It's drjspages.com. And if you go /store, let me actually put that in here. But there is a sale, and I'll also, let me send you also. And it is also going to be a 25% off. So everybody likes to save money. All right, good. So I just sent that to everybody. All right. Let me know if you could hear it. Okay, so on Facebook, it looks like it went through, but then it didn't go through. And then also let me give you the coupon for the 25% off. It's summer 25. All right. So if you see that, let me know, because it looks like that chat has stopped for a second. So let me know if you see what I just sent you. Okay, good. All right. So Stephanie, you say you can't see the video or hear anything. Huh. Interesting. Let's make sure you're on the right link. I'm going to send the link over. I don't know if this is the right one or not. This may be. See if that will help you. I don't know if that's going to help you or not. Good. Can everybody else see me? I think Stephanie's having a hard time seeing me, but can everybody else see and hear me? Okay, good. Yeah, some people are. It could be the phone also, but good. So what I'm going to do is I'm going to go over a few questions, but if you have any questions, please put that in that chat area so we can get down to it. All right. All right, good. There we go. Maybe it took a second. It looks like more and more people are being able to see me. So the first thing that I have as a question that showed up in the Facebook group was talking about success with reversing diabetes. Thank you, Russell. So the challenge that you run into with reversing diabetes versus managing diabetes is the following. Managing diabetes is what pretty much everybody does, right? It's the advice of like, well, watch what you eat, right? Eat healthy, go lose some weight, maybe go change your diet. And this is just basic, just be healthy sort of ideas, right? And also a part of that, when you manage diabetes, is doing whatever you can to lower your blood sugar. And the way our healthcare system does that, as you know, is drugs, right? Metformin, glipizide, glyburide, Trulicity, Genumed, Januvia, like there's so many medications, insulin, right? These are all different medications. And the medications, as you know, aren't fixing anything. These are just forcing your body to lower the blood sugar. The problem with that is it does create other problems. As you know, the medications that type 2 diabetics take have side effects. It affects the liver. It definitely affects the kidney. We always see these ads on TV. They tell you to take this medication and they give you the little benefit. And, these people running on the beach and everything's happy. And then there's like 20 minutes of like, it causes blindness. It makes your legs fall off. Like I'm being ridiculous, but you get my point. Like there's all these side effects. And I always think it's smarter to spend your energy and time working on getting yourself better. It was pretty remarkable. I don't know if that patient is on right now, but it's pretty remarkable because, many patients that walk into my office to reverse diabetes, they've never actually worked on trying to get their body back to normal, right? And people are asking, like, what is happening? Like, what is, like, why is it that I'm sick? Because today I had a chance to go over a bunch of lab results with patients, and we're trying to figure out what's causing their blood sugar or their difficulty with losing weight. And one of the tests I do is a very sophisticated stool test, and it looks for infections: roundworm, tapeworm, hookworm, yeast, fungus, parasites, Klebsiella, all these different things that could be raising blood sugar levels. And it's so common that someone's there trying to diet and trying to go to the gym and lose weight, but if they have their biome of their gut that's thrown off, it's almost impossible to actually get that normal. Well, it's actually impossible to get that normal through just dieting, right? You're not going to diet your way to getting rid of dysbiotic bacteria, right? There's no diet for that, or there's no diet to get rid and get the flora good, right? Like, you have to do things like supplements is what we do in my office, where I put someone on a protocol to actually fix those things. So when we look at like reversing diabetes, it's where you get your body back to balance, right? As a diabetic, the body is out of balance. And when this started, it's hard to say, but we look at maybe from the time you're originally born, right? Let's say you were born healthy and there was no, problems with your birth as you were born. Well, your body at that time was probably pretty healthy. It was probably pretty durable and could handle things. And maybe you did have a bad diet and, your body would go out of balance and then you would go back to balance. And then maybe there was something else that occurred and your body went out of balance and then back to balance. But the question is, well, how does someone get sick then? Like, how does these diseases happen? How do these cholesterol and blood pressure and diabetes and all these other things happen? It's very simple. It's actually where your body went out of balance and it wasn't able to fully recover, right? Maybe this was when you had a major hormone surge when you're going through having childbirth, or maybe a major stressful thing occurred to you, a family member or a loved one died, and it created a major stress and your body wasn't able to recover. Yeah, maybe like mentally you were better, maybe you were preying on it and things of that nature, but you just never got your body back to balance. And then you gain some weight, right? And that's a challenge. And then you're working late nights, and then if you have kids, you put your kids first and you don't eat correctly and that sort of thing. And then you have more stress and more late nights. And then, oh my God, you're trying to run to work and you don't want to get fired because your tire just got flat, more stress. And your body gets sick, right? And yeah, maybe you recover a little bit here or there, but essentially at some point your body can't look functional because you have all of these imbalances. And the reason why our system is broken, our healthcare system, is that no one's going and spending the energy and time to get your body functioning again. All they're doing is giving you a Band-Aid and another Band-Aid, another drug and another drug. And that's just not the way. That's not the way you get yourself healthy again. So a lot of times I hear patients, come to me and they want my help. And they're 70, 80 years old. And they're just like, oh, I'm 70, 80 years old. Maybe this is just the way it is. No, it isn't. Just because you're 70 or 80 years old doesn't mean you can't live like you're feeling like you're 30, right? And I know many of you have searched me out and you looked at my testimonials and all of these, successes I've had, and you hear all these patients talking about how they feel younger and they can't believe how good they feel and how they have more energy and all of these things. And what I'm doing essentially with them by reversing diabetes is getting rid of these barriers that is stopping them from healing, right? I'm just kind of getting rid of stuff that's making their body just not function the way they should be. So how you become successful with reversing diabetes is that you focus on getting your body back to balance. Now, one of the things that most people go to and lean towards who are diabetic is they talk about the diet. And you'll know from my patients, there's no fancy diet. It's a very just healthy diet. Meats, fruits, veggies. There's definitely a strategy, right? Like in the beginning, most of my patients I work with, their diet is more confined and then their diet opens up. And does that mean they can never eat a food that you would consider junk food? Yeah, of course, but they have to get their body healthy again to be able to endure that, right? Now, I think common sense is you can't eat unhealthy food all the time and expect to be healthy, right? Like that's just never going to happen. But the point is that you could have a relatively good, healthy lifestyle but you do have to do that while you're working on getting your body better. So when you work on and focus on stabilizing your blood sugar and making sure that your adrenal glands are functioning well and making sure your gut is good, these things make it easier for you to reverse diabetes. Okay. So that was one of the questions that people have asked. Now, if you want resources on my website, I have all the resources you need there. I have diets that you can get. I have recipe books and all those things that, you can find on my website. And then I do have supplements. Now, these are not specific to you per se, but many of the things that I do recommend with patients of mine are on my website also. There's a gut aid product, which is awesome. There is adrenal products, which help with stress. There are blood sugar products. There's a vitamin D coming out very soon, which everybody's been asking about vitamin D. So you'll see that very soon. It's being manufactured right now as we speak. I have a really good omega product coming out. That is really, really good as well. You'll see that coming up pretty soon, which is really good because that's also good for just general health. But anyway, the resources are there for you, but it's more of the approach of the diet you have stabilized, and that's going to help. But you also have to work on getting the body back to balance with proper protocol supplements, things like that to get things moving. All right. So good. The next question someone asked earlier today. Oh, by the way, for those of you who hopped on, because I see more and more people hopping on, if you have any questions, put that in the chat area. I'm going to get to that as we continue through this Facebook Live. All right. So good. This is a Q&A. So I'm answering questions, but if you have new ones, let's make sure we get those in there. All right. The next thing is a patient recently asked, we'll talk about why do they keep adding more medication? And essentially, it goes back to what I just mentioned. The reason why they're adding more meds, in most cases, it's twofold. Okay, I have seen patients that are non-compliant. They're doing all the wrong things, not eating the right way, doing these things that are going to cause them more harm. And with that, yes, they need more medication. The other part of that is that they need more medication because their body keeps going further out of balance. So as you get further out of balance, your body can't sustain it with that medication, right? Also, we see that medication also, sometimes your body gets desensitized to it. So this is where you start seeing someone who starts with metformin, and at some point the body doesn't respond and they need more and more medication. And that's one of the biggest reasons why we see that, most diabetics wind up needing more medication as time goes on. Whereas if, like I said, you work on the other part of it where you get the body functioning and things back to balance, that's how patients need less and less medication, right? Blood pressure included. All right, good. Let me stop here for a second. Good. A few more people hopped on. Welcome for those of you who just came on. And then could everybody see my posts? Say, can you see my posts? All right, good. Let me know if you could see that. All right, good. Can you guys see that? I'm just putting a pause in for a second. Good. Thank you, Russell. Okay, excellent. Good. If you guys have any questions, put that in that chat area. We're streaming out of 2 different Facebooks and also into a YouTube. So we have a few. I could see everybody on all different channels. And good. All right, great. Great, Michael. Awesome. All right, excellent. Now, the next thing that someone was asking is about hitting goals. And I want to, and I don't know, this is not a thing where I want you to divulge information, but I want to talk about getting to goals. And I meet patients throughout the spectrum. Remember, I've been doing this for 20 years, right? Once in a while, I'll meet someone that needs to literally lose 100 pounds. And then sometimes I'll meet with somebody who only needs to lose, let's say, 20 pounds, okay? It doesn't really matter the goal. It matters the time frame you put on the goal. So let me give you a good example. So one of the strategies that I see with diabetics is by kind of doing it by quarter, right? So many of you know this, but my kids are really big in sports. My son is really, really, really good at basketball. He's about to be a freshman in high school, and they are like really recruiting him to play varsity as a senior. And he's like a little dude, right? He's little, but he's really good. So my daughter plays volleyball. Most of you know this. And my youngest daughter, she's just cute. She's just 8 years old and cute, right? So she's not playing any sports. She plays volleyball, but she's just 8 years old and cute, right? So anyway, when we look at sports, right, we look at quarters, right? So when you look at like a basketball game, there are 4 different quarters. And if you know anything about coaching, and some of you know I have a history of basketball. I used to be the doctor for the Nets, right, basketball team. Well, when you break up each quarter, the goal is you want to have a goal for that particular quarter. So, for instance, if you're in basketball, you want to make sure maybe in the first quarter you're not losing by more than 5 points, or maybe you're up by 5 points. And then at halftime, which is the center of the game, same thing applies, and hopefully by the end of the game you win. The same thing applies to you with your goals. So let's say you do have a weight goal. The way you should break it down is give yourself a target. If it's a 1-year target, then you break it down into quarter. So play along. Let's say if it's January, you want to go from, let's say, January to March. How many pounds do I want to lose? And I usually recommend giving yourself a smaller goal, not too big of a goal. Because what happens is the body doesn't always work like that. Sometimes the body works where you start losing a bunch of weight and then you gain a little bit and you get, you don't want to do all that stress, right? You don't want that cortisol level raising up in the stress there. So you want to go through this like 3-month goal, right? And then when you get to your goal at 3 months, you want to celebrate. You want to take this win and you want to celebrate. But how are you going to celebrate? Well, you're not going to eat a bunch of crappy food. Now, even though you may eat that food, will it get you to get all your weight back? No. One bad meal, yeah, you may gain a little bit of weight, but it's mostly going to be out of your body in a couple of days, right? You're going to have a bowel movement and it's going to come out of your body. But the way you want to like really reward yourself is something like, well, maybe go and get a massage, or maybe go to a really good movie, or maybe go and do something that you're spoiling yourself with, or go to a really good restaurant and order really healthy food. So instead of getting regular cheap steak, maybe get filet mignon, or get like a very high-end sparkling water or something like that, right? So you don't have to spoil yourself by saying, oh my God, I just worked really hard for 3 months. Give me the biggest, cheapest cake you can get me at Costco and let me eat the whole thing, right? So that doesn't solve any problems. You don't want to necessarily do that. But you want to make sure you reward yourself after you get a goal. Now, once you get to that goal in 3 months, you want to start with another goal. The biggest problem I've seen for the last 20 years, right, helping thousands of patients, right, reverse their diabetes, is they reverse their diabetes. Well, why is that a problem? The problem is because they didn't think they can do it. Like this gentleman today that was there, and I don't know if he's on right now. I don't even know how to check, but yeah, I don't know if he's on. But the biggest thing with this patient today, that he's off of insulin in his first week, is like, oh my God, he doesn't realize he has a lot more to do. Like, yeah, great, off of insulin, high five, that's great. Like he's ecstatic. But it's his first week. He still has so many more things to do. And it's like, all right, picking yourself up, putting your bootstraps on and getting to the next goal. So whenever you're done with the goal, the thing you have to do is get to your next goal. You go and you create your next 3-month goal. So okay, now I lost whatever pounds you lost. Let's say you lost 10 pounds in 3 months. Great. Take that massage, do those things, and then go after your next 3-month goal. And you mark it in your calendar. You literally take your phone or you put that calendar on the wall and you mark it there and you go after that goal. And then for 10 points, guess what you think you do at the end of that goal? You set another goal for the next quarter. And the goal could be maintain a good weight. That could be a really good goal. Or maybe something else, like maybe you want to work on something else in your health. But the point is, as soon as you stop creating those goals and going after it, it starts getting boring and you start retreating and you start losing some of the gains you've made from all that hard work. So the best way in the strategy for hitting your diabetic goals, number one is set the goal. Okay, so if you're writing this down, number one goal, set the goal. Number two, put the date on the calendar. Okay, so you have your goal. Let's say it's 10 pounds, step one. Step two is put it on the calendar. Okay, good. So now you have your goal. You have it on your calendar. Good. Now, after that, you put down underneath it what your reward is going to be. Is it a massage? Is it buying a nicer dress or buying more clothes or something, right? My wife tends to never have a problem with that one, right? So she just, she's always, this is an argument in my house, if you guys want to know anything personal, right? I'm always looking at my wife like, why do you need all those dresses or all those shoes? You only have 2 feet, right? This doesn't make sense. And then she comes to my like library, right? Because I'm like a total nerd. And she's like, why do you need all these books? Like you have biology books. You're not going to read that. You've graduated college like God knows how many years ago. You're not going to read a biology book. So it's kind of like that's our thing, right? So it's okay. I love my wife to death. So she's good. She keep buying clothes. She earns it. She works hard. So, but as long as she keeps on letting me buy books. Now she's like fighting me. She's like, we don't all these bookcases. Buy everything on Kindle. I'm like, I don't like reading Kindle. Actually, I'm take that back. On Kindle Prime, I don't know if you guys are Kindle readers. My book was on sale, by the way. My first book I wrote. I have another 2 books coming out. But on Kindle, they have this scribe now where you could actually use a pen and write on it. I wound up getting it for like almost more than half off on this, like the Amazon day. And it's really cool. You can take notes. So I'm actually reading more books now that that's came about. So if you guys are into Kindle, good idea, something to purchase and make your life easier. Okay, good. So excellent. So good. Now let's go back to the ways of setting goals, right? Because that's what I was talking about. Number 1, know the goal, right? You got to get the goal. Number 2 is you put it on your calendar, mark the calendar. And then number 3 is doing what? Anybody want to put it in the comments? What's the third thing you do once you set the goal and put it in your calendar? Let's see who's got it. All right, let's see here. Anybody get this? Let's see. What's the third thing? It's like the most important thing. Yes, thank you. Thank you, Clarence. Thank you, Tammy. That is correct. You're going to put the reward. But the reward, it's not going to be junk food. It is not going to be something to shoot yourself in the foot with your type 2 diabetes. All right, good. Those are the questions I had. Now, at this point, it is open. So I'm going to be on for a few more minutes. So if you have any questions about reversing type 2 diabetes or you want to share anything, please put that in that chat area and I'll be able to get to it before we end off here. Good. Let's see here. Oh, good. I just got a question about. Oh, apparently. Okay. So someone was asking about. This looks like you. Is this YouTube? I think it is. Clarence. So does my program include shakes? So yeah, there are. It depends upon the patient. But yes. Just so you know, and I'm just going to change the wording. So Clarence's question is, does your program include shakes? Yes, but I don't really have a program. It's more of like individual care for each person. So everybody in my office always starts with a protocol that involves shakes, and that helps clean the liver out really good. And then after that, many patients do take the shake. Actually, the one that most patients take, they really like. That's the one that's on our website. So you'll see that there. It doesn't reverse diabetes, but it's just a really good protein shake. It has great amino acids. Has B vitamins. It's good for fiber. It's good for stabilizing blood sugar. It's good for cravings, and it's really yummy, like really really yummy. So yeah, some of it, but it's not like you still have to eat. You can't do like a shake or meal replacement, Clarence. That would never work, ever. So no, you don't want to do that. You're eating food, and then shake is added to kind of the way things, the protocols and supplements. Yep. Good. Any other questions? Are your supplements food grade? Yeah, of course. That's so funny. Yeah, you can see more about that on the website, so good. If you guys have any questions about reversing diabetes, please ask those now. Good. All right, good. We got 1 minute, so the timer is set. All right, excellent. So good. Let me end off there. So let's go back over the things we discussed today in the Facebook Live. How easy is it to eat out? I really don't cook well. Yeah, like Russell, it's really easy. If you download some of the diets on my website, you could follow those. I've worked with many truck drivers throughout the year, many truck drivers, and I've never had a truck driver fail. So I always look at it like if they can do it, then anybody can do it. So good. So look at those great questions. So how do you reverse diabetes? By fixing why your blood sugar level's up in the first place. That was what I was talking about in the beginning, Renata. So That's the way you approach diabetes. So diet is a foundation. And then in my office, we use supplement protocols to fix the imbalances. So whatever is out of balance, we use supplements to get the body back to balance. And then at that point, you usually don't need a lot of supplements once you get there, but it's kind of like building the house. You need a little bit more work. So number one is successful reversing diabetes, fixing the root cause. Number two is they're adding more and more supplement or more and more medication rather to your life because your body is not getting itself back to balance, right? So that's another thing that's important. And then the strategy for hitting your goals, set your goal, put it in your calendar and reward yourself. And then, oh my gosh. So Tammy Bryant, no, I don't like HelloFresh, but there are things out there that are pretty good. And then my thoughts about juicing for weight loss. Probably the worst thing you could do for your metabolism is juicing. Now you will lose weight, but because if you have like insulin resistance, you're just literally losing weight for a period of time. And because no one can sustain that for a long time, you're shooting yourself in the foot and you'll gain all your weight back. And it's not going to fix a darn thing. As a matter of fact, let's look at this, right? Let's say you're juicing all day and you're giving your body sugar and you have an infection. Well, you're going to be feeding that infection, which is going to literally avalanche into something far worse. So that's the things they don't tell you on the juicing commercials. Remember, what's his name? His name was Cornish or something. The guy back in the 90s, he was the juice man. I forget what his first name was, but he was the juice man, and he would have a really good idea. And some of those ideas are really good, but not when you have a broken metabolism, right? If you have a broken metabolism, it's something different. Like if my kids juice and their metabolism is good and they're running around and they're using it up, yeah, great. But like someone who has a broken metabolism and they have to lose weight and they're a diabetic, I've never seen juicing actually fix anything in labs. And that's what I go by, right? So yeah, we want the testimonial of someone doing well and their life improving, but we want proof of it in the labs. So I have evidence, hey, they really reversed their diabetes, which include getting their liver better, getting their thyroid better, getting everything functioning. So good. All right, excellent. I think I answered all the questions. You'll see a recording of this. I first off want to thank you for coming. I'll be doing this every Monday at 6 o'clock. So I welcome you to the next one and enjoy it. And next time, bring more questions. And remember, your body is born to heal. So be well, stay well, and have a great rest of your day. All right, take care, everyone.